and then came back to New Zealand and did some psychiatry, but got sidetracked into cosmetic medicine and started doing both cosmetic medicine and psychiatry at the same time. And cosmetic medicine won.
So why don't we wind things back a bit? I know you studied psychiatry before you went into aesthetic medicine. So maybe just give us a bit of a flavour for sort of where you were at that time in your life. What were your motivations for getting in the industry?
Fascinating.
Yeah, and what it was like back then too. I mean, what was the industry like back in those days in New Zealand?
Yeah, it was. So I was a junior doctor at Waikato Hospital, and then went to the UK. Because I met an English doctor who was escaping the NHS, and
sounds like
we both went back to the UK.
There's a few of us, yeah.
And so he was like, Anyway, so we went back there. I had actually done my trainee intern elective I did in dermatology over in the UK at St Thomas's, and then also it was called the St John's Hospital for Diseases of the Skin. It was like a tertiary referral centre, very serious, very academic. Did that as an elective and went, maybe these aren't my people. Obviously, I hadn't met the cosmetic dermatologists, who are a lot of fun. And so I was over in the UK locuming, and where there are no jobs when there's the new doctors come on, and there are suddenly no locum jobs. And I was offered a job in old age psychiatry at Graylingwell Hospital, and it was sold to me as being pretty medical, because I was a medical SHO. Sold to me as being pretty medical, because often it's physical diseases that are the problem. So I managed to secure a position 6 months paid at locum rates because they were desperate. And I thought, great, I'm going to pay off my student loan. And I went and did this job in old age psychiatry, and I just loved it. I was really surprised to find that I absolutely loved it. I had lots of time to talk to patients. I love talking to patients. I had a whole hour to do my assessments instead of the roller coaster and the production line of the limited time you have to spend with patients in the busy emergency department. And from there, then went to Charter Nightingale Hospital, a private psychiatric hospital in the UK, and started locuming there, and just really was fascinated by the kind of mind-body interaction. Because I also then went on to the Maudsley Hospital, working in the Lishman unit doing neuropsychiatry, where we used to see we would see dissociative seizures and psychiatric disorders that didn't have a function, sort of the functional disorders. And this was back in the early, about 97, 98. And so I learned again a lot about the mind-body connection. And then came back to New Zealand and did some psychiatry, but got sidetracked into cosmetic medicine and started doing both cosmetic medicine and psychiatry at the same time. And cosmetic medicine won.
It's fascinating, because I reckon back then people would have said, these things aren't related, that seems crazy. But now, the more and more we get into it, that's an absolutely perfect blend of, specialties. So did you recognize that at the time, or did you think, oh, this is a bit weird, these things aren't very allied?
Totally. I mean, I remember coming back and thinking, I want to get into cosmetic medicine. The reason I knew about cosmetic medicine in the early days was I'd been getting dysport in the UK. Right. So I went to Dr. Not Stephen Lowe, that's Nicholas Lowe, dermatologist in the UK. Gave me my first treatment ever, 1998, with dysport, and I bloody loved it. It was awesome. I looked a lot more lined than the beautiful skin of the UK girls, and I'm like, oh God, I seem to be really wrinkled, and I'm going to try a little bit of the dysport. And so when I came back to New Zealand, I then sought a Botox provider. And they were absolutely lovely and very chatty. And I remember saying to them, what's this job like? And they just said, it's awesome. I love it. It's so positive. It is so interesting. And that just started a spark in my mind of, this is a new area that potentially I could do, because I'd always been interested in art and fashion and everything like that. And in medicine, it didn't really have a home, those sorts of interests. And then all of a sudden, here was something that combined those interests. And I was just very strongly attracted to the area, but it was so small and fledgling and not recognized. I just didn't know whether it had a future.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.